That looks much better.
All right. Well, greetings. This is Dr. Kevin Seaman with Chief Andrew Spalding, and we're here to introduce you to the viral pandemic triage protocol. And I just have a few words of introduction here, and we're going to work together in a team fashion. But so with regard to this protocol, you've heard when describing our EMS system, the right resource for the right patient at the right time and the right destination. I think this is just recognizing the 80% of patients that are going to get better from this, that have low risk criteria, that can shelter at home, and allowing us to do something, innovate in a way in this outbreak that may help us test some tools that might be useful for us going forward. Now, with regard to that, the other real big message I think that I want to convey to all of you is keep the faith. And what I mean by that is those of you that are wearing your PPE as from the guidance from the protocol and from Dr. Chismar at the state, you're doing the right thing. Bravo, keep up the good work. Don't make the mistake of thinking this is starting to become less problematic and we should abandon our PPE. Don't think that at all. If any of you are not wearing PPE, my message to you is you must wear it. And let me tell you why. So over the next two weeks to 2 months, the number of COVID cases will increase in our community. We need to partner with our public safety team members, as well as county government, as well as the citizens and residents of Charles County, to continue to incorporate those best practices of, and you know them well, social distancing, washing hands, wearing masks, covering coughs and sneezes. If we're successful at that, then we'll decrease the number of hospital admissions, ICU admissions, and deaths, and the incidence will go down. But it's only through persistent commitment to these best practices that we can beat this outbreak and prevent a pandemic. And so you, our EMS clinicians, are the most important resource. Protect yourself and your families. We'll get through this together. And I look forward to seeing you on the other side of this challenging experience. So I'm going to turn it over to Chief Spalding to give a few words here. Chief?
Hey guys and gals, it's Andrew. Just wanted to mirror exactly what Dr. Seaman was saying. First and foremost, thanks for all of your dedication and hard work that you guys are putting in. I know it's scary times that we're treading on, but just know we're all in it together, and hopefully we're doing everything we can to help you guys get through it. If not, please don't hesitate to reach out to Dr. Seaman, myself, Mark Kaufman, anybody. We're more than happy to help in any way we can. The first thing I wanted to touch on with regards to the viral pandemic triage protocol would be to make sure you use it as specified by MIM. So you're going to see the check sheets and all of those tools that you have. Make sure you use them as specified because it's very important. I know it totally changes our way of thinking, as Dr. Seaman said, with what we're used to doing and the way we've been trained for all these years to try to do everything in your power to get a patient to go to the hospital. But as he said, it's totally uncharted waters for us, and we're all doing what we can to help the system out. And I truly believe this is going to be a very good thing for us in Charles County. It'll limit our exposure and everybody's exposure in general. So just make sure you use all the tools we have at our disposal when we're implementing this. Second, and just as important, is to make sure that all of you as responders are going on our Charles County Infectious Control Tracking website, which is covidpui.com, covidpui.com. And that's the website that the medic unit was able to make for us that helps us with tracking your exposure. So we need one provider from each unit. It's not necessary for if you have 2 or 3 people on the ambulance or engine to each fill it out, but one person, one provider, whether you're fire or EMS, to go on that website at the completion of the call as soon as you can and fill out the information that they're asking for that helps our County Infectious Control Officer, Madison, export that data into an Excel sheet, which then helps her track the potential exposures as we're getting them from the EOC. As I said with the fire, it's very important for fire to do this just because no patient care reports are done. It's a surefire way for us to be able to track firefighters' exposures just the same as EMS providers. So it's just as important for the fire department to do it as well. It yields much faster results for us. Like I said, as soon as we get a report of a patient, which is actually turning around within about 24 hours or so, I'm noticing now we're finding out about the patient exposures and positive tests. We're able to go in almost immediately and figure out who was on the call, and Madison then works with the department chief and the infectious control officer of the station. The last thing I really want to touch on is making sure you have your reports done within 24 hours. I cannot stress the importance of that enough. I know it's in COMAR regulations and everything else, but what we are noticing is a slight trend of when we're getting these positive test results back with the patient name and transport time, and that's all we're able to get. And then if the patient care report's not done, we don't know who the providers were, and it's just a bunch of extra legwork. We eventually get to the bottom of it, but that's all prevented by making sure you do your report as soon as possible when you get off. So if Dr. Seaman doesn't have anything else to add on any of that I touched, that's all that I have for you.
Yeah, no, great job. I was going to add one thing, Andrew, and that is just that, we're piloting this at Station 60, so people need to be aware of, you are on the front lines. We need your input on how this is going from your perspective. What is your experience? How's it working? How well does it fit how well does the sock fit the foot there in terms of fitting into our shoe here? And so we're going to be looking for feedback from this pilot, and then from that we can talk about generalizing to the rest of the department, all of our department, basically. So I think, again, thank all of you for your hard work and your bravery in this unknown kind of outbreak. We're in it with you together. We're going to get through this together, and we'll see you on the other side. And thank you so much for everything you do. Thank you, both Chief Civiter and Chief Spalding. I look forward to continuing to help do this and help work together. Okay? Take care. Have a good day.
Thank you as well, Dr. Seaman, and thanks to the Mobile Intensive Care Unit for assisting us with this. Thanks.
Absolutely.
Welcome to the brief just-in-time training module that will review the Viral Syndrome Pandemic Triage Protocol. This is a 2020 MIMS emergency protocol, and this training will familiarize you with the protocol and how it is best applied. Upon completion of this training, you will be familiar with the COVID-19 pandemic, recognize the signs and symptoms of COVID-19, review the MIMS Pandemic Triage Protocol, and be familiar with the documentation requirements associated with the use of this protocol. COVID-19 is a viral illness that originated in Wuhan City of the Hubei province of China in December of 2019. It has since become a global pandemic. It's much more serious than the flu and has a higher mortality rate. The virus is easily spread from person to person through respiratory droplets that are produced when the infected person coughs or sneezes. More cases are reported every day around the world, as well as here in Maryland. Unfortunately, we have seen a significant rise in cases since the original case here in Maryland on March 5, 2020. States of emergency have been declared in our country at the state, local, and federal level. We anticipate the need for significantly higher EMS and healthcare resources as the number of patients will increase during this time. There's a serious concern regarding the number of people who might require hospitalization and those who will also require ICU level resources. Signs and symptoms of COVID-19 may include fever, cough, congestion, shortness of breath, new body aches, and in some cases diarrhea. The most common symptoms are fever and cough. These symptoms can begin anywhere between 2 to 14 days after exposure. Around 80% of those infected will have mild to moderate illness. However, in the remaining 20% of those with COVID-19 infection, they can develop a complicated clinical course of illness. In some cases, COVID-19 can cause damage to the lungs and cause pneumonia, or a life-threatening condition called acute respiratory distress syndrome, or ARDS. Identifying a patient with COVID-19 or someone under investigation with COVID-19 has continued to evolve in terms of its definition. At the time of this recording, any patient with any of the following should be considered a PUI or person under investigation for COVID-19. That's any patient with fever or cough or shortness of breath or flu-like symptoms that include sore throat, congestion, cough, body aches, or diarrhea. Those individuals should be considered a PUI, and our EMS clinicians should take the appropriate protective precautions for the patient and themselves. Remember that the patient only needs to have one of these symptoms to be considered a PUI. This is important as the definition of a PUI is broader than the definition of who is eligible for the non-transport option of this protocol, which we will review in the coming slides. In light of this pandemic and the potential for unprecedented patient volumes for both EMS and our hospitals in Maryland, the leadership of the Maryland Institute for Emergency Medical Services Systems has instituted an emergency protocol entitled Viral Syndrome Pandemic Triage Protocol on March 17, 2020. This protocol seeks to identify those individuals who are safe to be managed by supportive care at home. It also serves to help the EMS clinician promptly recognize a patient who should be taken to the hospital because of high-risk criteria. This protocol can be used by both ALS and BLS clinicians. It's intended to help differentiate between those patients who can safely manage their care at home from those patients who have high-risk criteria and should be transported. The protocol itself consists of a checklist that guides the EMS clinician through a series of questions that cover inclusion criteria, high-risk conditions, and concerning exam findings. If any of the gray boxes are checked, then the EMS clinician shall encourage the patient to be transported to the hospital. If a patient has gray boxes checked and does not wish to be transported to the hospital, the EMS clinician shall follow the Maryland refusal protocol. In order to be eligible for the non-transport option within this protocol, all check marks need to be made in the non-shaded boxes. If a patient meets these criteria, then a refusal is not necessary. Also, I'd like to take a moment to remind you that as an EMS clinician in caring for this patient, you have the ultimate discretion to transport the patient even if no gray boxes are checked, if you have a concern and believe that's in the patient's best interest. If all checks are in the non-shaded boxes, the patient meets eligibility to provide self-care at home. A 3-page instruction sheet has been created and adapted locally. These instructions shall be provided to all patients who are not transported by EMS. This instruction sheet includes local phone numbers for the patient to use should they have further questions, as well as resources for them to connect with primary care. In accordance with MIMS guidelines, the EMS clinician shall document every use of the protocol under the newly created COVID-19 tab within eMeds Elite. The Elite questions directly match those questions within the protocol checklist. Also, note that a signature option of not signed patient contamination concern has been added. This has been done to help minimize chances of contamination of our IT equipment. EMS clinicians shall complete the rest of their pre-hospital EMS chart per normal procedures. In accordance with MIMS guidelines, we are required to follow up with patients who are not transported under this protocol within 24 hours. As previously mentioned, it's very important that we obtain a good patient phone number for follow-up purposes. That phone number shall be documented in this area within the COVID-19 tab in Elite. Documentation of the phone call itself will also occur in Elite, and there will be an option for a follow-up visit as needed for certain patients. This follow-up phone call and possible follow-up visit will not impact field operations, and this will be performed through a separate headquarters function. Let's take a moment now to review a practice case of how we would apply this protocol. In this case, we have a 35-year-old male with 3 days of fevers. He has since developed a bad cough and body aches. His past history includes diabetes and seasonal allergies and gastric reflux. Upon vital signs, he has a heart rate of 104, a blood pressure of 132/64, a pulse ox of 96% on room air. His lungs are clear. He's breathing at a rate of 20 times per minute, and he's ambulating without any difficulty. Is this patient eligible for the non-transport self-care option within this triage protocol? Take a moment and think about it. If you said no, you would be correct. Since this patient has diabetes, he is considered to have a higher risk of a bad outcome from COVID-19, and it is recommended that he should be transported to the hospital for further evaluation. Let's try another case. Now we have a 42-year-old female with 2 days of body aches, cough, and general weakness. Her history includes that of high cholesterol. She has a heart rate of 110, a BP of 118/58, a pulse ox of 95% on room air, respiratory rate of 20, and she's ambulating without difficulty, and she's agreeable to stay at home, and she feels safe in doing so. Is she eligible for the non-transport self-care option? Take a moment to review the information. If you said yes, you would be correct, since this patient does not have any high-risk features as identified by the viral syndrome pandemic triage protocol. In other words, no gray boxes are checked. This patient would be eligible for the non-transport option. As a reminder, as the EMS clinician on scene, it's ultimately up to you to decide, even if no gray boxes are checked, if you think the transport to the hospital should be recommended. Thank you for watching this brief just-in-time training program. If there are any questions or concerns, please reach out to your local EMS Operations Program Leadership or contact the MIMS Office of the State EMS Medical Director at 410-706-0880. Please stay safe, take care of yourself, take care of each other, and take care of your families.
This slide reinforces the message from the Medical Director, the County EMS Chief and the Infectious Control Officer. PPE must be worn for suspected PUI calls. Do not engage the patient without it. Do not remove it in the presence of the patient until the end of the call decon. Take 2 minutes immediately after the call to fill out the report at covidpui.com to indicate contact or exposure. This goes directly to County EMS Chief, ICO and JMD and is linked back to the provider in the event of a positive test. It protects your providers. All units, fire and EMS with contact should fill out this report. All patients shall wear face coverings at all times during contact. To ensure that we all have PPE, use the 213 form and send to Assistant Fire Chief Scott Herbert at the shown email address. We need to request before stocks are depleted and keep track of stocks so that we don't run out. PPEs for all providers, career and volunteer. We are one team. To collect your CEUs for this training, email to the address above and we will send your certificate by email. Thank you for watching this video, and thank you for everything that you do. Together, we will get through this dark time. We are trained for this. This is our time. If we don't do it, then who will? Thank you for what you do, and stay safe.